Hello, my name is Laura, and I'm a mother, wife, daughter, sister, and nurse. I was diagnosed with idiopathic dilated cardiomyopathy and congestive heart failure. My heart journey began in 2007. I was 38 years old. I remember feeling my heart beating fast, having shortness of breath, and pressure in my left arm and chest area. I went to the ER where an ECG showed a left branch bundle block. I was told I did not have a heart attack and not to worry. The following few years, I progressively got more tired and showed worsening signs of my symptoms. I also had an irregular heartbeat, bloating of my abdomen, and now started to have high blood pressure. I was told I was depressed, was prescribed antidepressants, and was told that nothing was missed. Finally, in 2014, I was transferred to the Heart Function Clinic where I was given my final diagnosis. Besides the reality of having heart disease, I remember feeling a sense of relief, knowing that everything I had been feeling was real. Although I was young and healthy, my risk factors included a family history of heart disease and hypertension, as well as preterm labor, delivery of a late preterm infant, and slight hypertension during pregnancy. Since then, I have learned the importance of keeping an open communication with my healthcare provider. I remember to always keep calm, remain curious but not furious, and that I know my body best. I want others to see that I have learned how to control my heart disease, and it doesn't control me. My disease does not define me. I also want other women to remember not to ignore their symptoms because their heart health comes first.
In support of WearRedCanada, here with us today is Dr. Christine Pacheco. Dr. Pacheco is a cardiologist and women's heart health specialist at the University of Montreal Heart Center and Pierre-Boucher Hospital in Montreal, Quebec. Today, we have the pleasure of briefly talking to her about cardiovascular risk factor for women. Thanks for being with us today.
Thank you so much for having me.
So Laura mentioned in her story that she was diagnosed with idiopathic dilated cardiomyopathy and congestive heart failure. How would cardiovascular risk factor play a role in her diagnosis?
So we know that traditional risk factors such as high blood pressure, diabetes, smoking cigarettes can all contribute to heart failure and increase the risk of having this disease. There are also some genetic causes that can cause this disease. And more rarely, sometimes dilated cardiomyopathies can be associated to complicated pregnancies.
Thank you so much. I've heard also that of the traditional risk factors like diabetes and hypertension. How are these risk factors different for women?
So we know that traditional risk factors affect both women and men in their risk for heart disease, but certain risk factors will increase the risk higher in women than in men. For example, diabetes is one of those risk factors where women with diabetes are at a higher risk of developing things like heart disease or heart failure. Same for hypertension. We know that women following menopause are at greater risk of developing hypertension and therefore at greater risk of having this risk factor play a role in the development of cardiac disease. And finally, cigarette smoking increases the risk of heart disease greater in women than in men.
Thank you. And do women and men have different risk factors for heart disease?
Yes, they do. So women experience several events throughout their lifespan that may contribute to their cardiovascular health. For example, pregnancy is our real first physiological stress test as a woman. And certain events that happen during pregnancy can be harbingers of problems later on. Things like high blood pressure during pregnancy or a condition called preeclampsia. Things like diabetes during pregnancy or preterm birth can all increase the risk of having heart disease, including heart failure, heart attacks, and strokes later on in life. And other conditions such as polycystic ovarian syndrome and menopause can alter the risk of heart disease in women.
And if a woman is concerned they may have these risk factors, what can they do?
So women concerned about these risk factors should definitely talk to their healthcare providers to get more information and have annual workup, including verification of blood pressure, blood sugar, and cholesterol levels. Women should also adopt a healthy diet. Usually a Mediterranean diet is recommended, and perform exercise. The recommended amount is usually 30 minutes of moderate activity about 5 times a week.
Thank you, Dr. Pacheco, for the valuable information you shared with us today. We want you to be mindful, curious, and proactive in the management of your health and wellness. Because to take care of others, you need to first take care of yourself. Stay safe and healthy. To learn about the unique aspect of heart disease in women and what you can do, visit WearRedCanada.ca or speak with your healthcare provider and join us on February 13 for WearRed Canada.